person.
Right. Okay, we are live.
Hello.
Well, good afternoon, everyone. It's 1 p.m. on the East Coast. My name is Tracey Welson-Rossman. I'm the founder of Journal My Health, which just launched our app to help long COVID patients track their symptoms and gather all of their information. We are on the App Store. We just launched on Wednesday. And we decided that we should start having some, content to put out there to talk about patient-centric healthcare. That's what we're going to be focusing on as we continue to go out. And I'm very fortunate to have as our first guest, who I met at South by Southwest virtual this year. So very happy to have met Joyce Griggs, who is the founder of the United States of Healthcare. And what attracted me to Joyce and her bio was, her discussion of patient forward, patient centric. So as today we're talking about how to be your own health advocate. So first, I just want to say hello, Joyce. Welcome from New York. And can you tell me a little bit about why you founded the United States of Healthcare and what your purpose is?
Sure. Thanks, Tracey. It's great to be here with you. And I think it's so great that we met virtually through South by Southwest virtually. That was special, especially for this year. So United States of Healthcare, essentially our vision is we believe that navigating the U.S. healthcare system should not be more difficult than living with the condition itself. And that no one should have to spend more effort to navigate the system than they do just in dealing every day with whatever conditions they happen to be dealing with. So we wanted to start a website and a blog. The blog is really the centerpiece of what we're doing right now, which collects, curates, and tells the stories of healthcare insiders. Because one of the things that we found, and I found through my own story, is that even when you know a lot about the healthcare system and you're an expert, or because we've had people who are healthcare providers tell their stories, or even somebody like myself who's worked in healthcare for many years and knew a lot about how it worked, but when faced with having to navigate through the system, found it extraordinarily difficult. And so it occurred to us that it was really important to tell these stories so that there was a way of having that empathetic moment. I mean, we're built for storytelling and for taking in information through storytelling as humans. But then also we ribbon these stories with very concrete, very specific pro tips. So either to help you do what we did or help you to not do what we did, because sometimes we make mistakes. So that's what we're all about. Yeah.
That's amazing. So why don't you tell me, if you don't mind sharing a little bit about why you founded the United States of Healthcare?
Absolutely. Happy to tell you. So my former husband, George, who is all in favor of United States of Healthcare and us telling our collective story, had knee replacement surgery. And he also had other health issues, mental health issues, and addiction issues that exacerbated his condition. And so we found ourselves careening really through a very scary time, because the specialist who replaced his knee was excellent at what he did, but he looked at none of the other things that were happening with George. Right. And so he wound up see, there's Grace Belmonte. Hey, Grace, how are you? So George, wound up in a situation where he needed a lot more than somebody just looking at what was happening with his knee. And the healthcare system was letting him down in that way. So I began to advocate for him and demand certain things happen in the coordination of his care. And had a lot of help from some really great nurses, as it usually turns out in healthcare, great doctors, but man, the nurses, they are the heroes. And they coached me, and I learned to become an advocate. And so I realized, I was like, wow, if it's this hard for me and everything that I know, what's it going to be like for others? And I then started soliciting stories from folks and began to realize that we need to share this and get it out there so that every American can have the tools to really be their own self-advocate, because self-advocacy is what it's going to take. There's a lot of things we want to see happen in terms of the system changing from the outside, but we can change it from the inside through our behavior.
That is such an important point. We totally understand that, yes, there's issues within the insurance industry, the healthcare industry, and sometimes we may feel like we're powerless, but as individuals, we can empower ourselves to, do things that are good for us. And sometimes it can be tiring. So it's great to have some of these tips to have. So, just to sort of put this point out again, you're saying that people need to be their own advocates. What are some ways that you can crystallize that for those for those of our listeners and future video watchers that they could take hold of?
Sure, absolutely. And I can tell some of the stories and then some of the tips that go along with that. But one of the things I wanted to stress is that there are some of us who have health conditions that are ongoing that we're living with. Right. There are others of us that go to our doctor a couple times a year, and we think we're kind of one and done. And what you begin to realize as you start looking at taking care of ourselves and taking care of our health is that even those of us who are maybe just going to the doctor a couple of times a year, there are still things we can do to get into a partnership with our healthcare providers and really become a partner in that coordination of our care, because you never know what's around the corner. So it's really about preparation. So we recommend and really advocate for self-advocacy in our healthcare, regardless of current health condition. Some of the things that to take into consideration, for example, something as simple as looking for a new healthcare provider. Seems like, okay, that should be maybe not so hard. I think about the story on our blog of Jennifer Sleppen, who is an RN and was diagnosed with hepatitis C. Went into treatment, and this was many years ago. Right now, there are many, many amazing treatments for hepatitis C that cure hepatitis C. In her time, it was before some of these more modern drugs. So she was treated for a long, long time. And she was treated at a teaching hospital known in the parlance as an academic medical center. So she had a great specialist on her team. But then Jennifer got a new job, and Jennifer was moving, and she still needed to continue her treatment. So now what do you do about a referral? And a lot of times we get in our car, or we get on the airplane, and we move to the new community. And then we think, oh yeah, I guess now it's time to go to the doctor. I better find a doctor. But we've already in advance taken care of internet service. Where are we going to go get our nails done? All these other things, and the healthcare maybe gets put to the side. So what we recommend is talk to your doctor about referrals before you leave the community, because especially if you have a condition that requires a specialist, that doctor or nurse, if you're seeing a nurse practitioner, may make that phone call for you and help you to get that referral. So it's critically important to think about these things. Put that on your list of if you're moving, put it on your list of something to take care of before that happens.
Okay, hopefully you're not hearing the vacuum going on at my house, but welcome to doing these things at home. So that's one great tip, which is, use your current healthcare providers to help you find other healthcare providers, whether you're moving or not moving.
That's right.
So I would put that as pro tip number one.
It's pro tip number one. The other, in that same vein of looking for a new healthcare provider, in a recent post, kind of put together a post that takes you through what are the steps that you should take when you're looking for a new healthcare provider, because there are many websites that will help you do a real analysis of your healthcare provider. So you may have a list from your insurance company, because that's the first place we need to go. Let's face it, it's, are they covered? Are they in network? That's the first thing that folks look for. After that, there are websites that you can go to. And if you go to www.unitedstatesofhealthcare.com, you'll see the different sites that you can go to where you can get an analysis, put in the name of your doctor, their education, and also their specialties that they have. Where are they board? In what areas are they board certified? As well as, are there any actions against these doctors? Because you want to make sure that they have a clean, that they don't have any malpractice or other things, actions against them that would preclude you from wanting to see them as your healthcare provider. We also include a set of tools for how do you then go about interviewing doctors, because if you do have choice, not everyone has choice, we recognize that given where you live and your geography, but if you do have a choice between a couple of providers, then we have a list of questions that you can ask them, as well as questions that you can ask of the front desk staff, because you're going to be in partnership with this person. So even if you don't have choice, let's just say you're in one of those situations where this is the only game in town, at least by asking these questions, you then begin to get a sense of what's their communication style. Does it work with mine? Not really, but that's good to know going into this, because I'm going to have to then maybe do a little more to get what I need. The office staff, wow, they were really friendly. They really helped me out. Or now I know what it's going to take to see this, to get an answer, an email from this doctor in between visits, or this nurse practitioner in between visits. So we try to give as many tools as possible to help us in as many situations as we may find ourselves.
And that's really interesting. I don't think a lot of people think about interviewing their doctor, like having this set of questions, because we feel they have the power. Yes.
And it really is changing that mindset about, look, the doctor, the nurse practitioner, years of schooling, you're going to them as the expert. But if you were looking for a new accountant, or someone to redo your kitchen, or someone to work on your car, we usually, what do we do first? We go to trusted sources, friends, and that's the first thing to do when you're looking for a healthcare provider. And then we talk to a couple, right? And then we make a choice based on informed decision making. We do tend to give our power away a little bit. It is a cultural thing when it comes to healthcare providers, and so we're all about a reset of, as patients, we need to have a seat at the table, and we need to have a voice in our healthcare for our own good.
So that's pro tip number 2. And can you give us one more?
Well, the third one that I would give has to do with pharmacists. And pharmacists are really a secret weapon in many ways, community pharmacists. We have a lot of access to pharmacists in our community. We all see our pharmacist many, many more times in a given year than we do our doctors or our nurse practitioners as our healthcare providers. So the pharmacist is a critical member of the team. And I think about the story where a friend had a very bad reaction to some medication, wound up hospitalized because of it, but then was on a series of medications. So what they did was they took that list of medications and they took it to their pharmacist. And the pharmacist, they are really the side effect experts, even more so than doctors. It's an important thing to know, because they know all the medications. And if you're seeing a primary care doctor, maybe a doctor for say diabetes, an endocrinologist, maybe a cardiologist, if you're seeing multiple doctors and they're putting you on multiple medications, they may not know what the other healthcare provider is doing. And so the pharmacist, that's why it's really important. Number one, use one pharmacy and have all your medications filled at one pharmacy. Pick one, go there. And then, so A, you'll always be able to have your list of medications. And then number two, you can ask your pharmacist to do an intermittent review of your medications to just look for any issues that there may or may not be within the list of medications that you're taking. And of course, they can answer your questions very readily.
That's an excellent tip. And I think that we forget, sometimes we're, again, afraid to ask questions because we feel like this is beyond our capability. But, I would just add that fourth pro tip, which is, feeling confident in asking those questions regardless. But I love that. Use your pharmacist. And I will let you know that my grandfather was a pharmacist and the kindest. Yeah. So he's definitely somebody who would have taken that time to set aside and talk to you. So that actually may be a little plug for your neighborhood pharmacies versus, just your larger pharmacies, but sometimes we don't have that luxury.
Yeah. One other thing that I'll just say about pharmacies, and I have a lot of pharmacists in my family too, so it's close to my heart. Even if you're going to a chain pharmacy, there are usually many chain pharmacies in one community. Try to go to the one that isn't busy. Try to go to the one that, even with chains, there's always going to be the sleepier one. Try to pick those because you'll be able to get more time and more care.
And these are so simple. What you were talking about are just simple changes that we could make.
That's right.
So that we have, just more information about ourselves. So Joyce, we decided that we were going to keep this to 20 minutes, and I think we're just about there.
Yep.
I hope everyone who's watching was able to get some great information. Thank you for your comments. I see us doing this again. I think that Joyce has some more pro tips, and maybe we'll even bring some of the people who've written blogs for her, been written about, so they can talk about their stories. So thanks everyone for joining us. This really went fast, and I hope that you were able to get a lot out of it, as I have today. There's definitely some tips that I'll be taking.
Thank you, Tracey, and thanks everyone for being here.